All right, we share the screen. There we go. Okay, cardiovascular disease. We'll jump right into some of the statistics on this one. As you can see, this one is the most prevalent death that you can have in the United States. It's also worldwide. When you look at worldwide, the numbers change a little bit, but it's 40% of all Americans die from cardiovascular disease. The cost in the United States is about 239 billion. Worldwide, I think it's getting closer to 600 billion. So the reason why the United States has a share of that is because we treat a lot of people with heart disease. Most of the world, I mean, there's a lot of world out there. Not all of them treat heart disease like we do here, so we spend a lot of money on it. Almost 700,000 people die from heart disease in 2021, and that's about 1 in every 5 deaths that occurred in the United States. So it's a pretty prevalent disease, and it happens because of the way we treat our body. So this presentation, more than anything, will talk about how we treat ourselves and how we can control or reduce the risk for cardiovascular disease. Besides that, CPR and other medical techniques, the AED was a huge contributor to saving lives with those suffering heart attack. Without the AED, CPR was really just kind of a good luck thing. If any of you have been trained in CPR, good for you. I really believe I'm one of those believers that everybody should be trained in CPR, just because of the prevalence of heart disease. Everybody gets it, so there's a lot of deaths from it. So we should, I think, I'll be trained in being able to save lives. Anyway, that's my soapbox. Here we go. So when we look at cardiovascular system, we're looking at the circulatory system. We're going to look at what the fluid gets pushed through, so vital organs, and how it gets there. So we got to look at arteries and veins. We're going to look at the heart specifically, and then the importance of the sinoarterial node, or the SA node. And I'll talk about that here in the next slide. So here's your heart. You'll have to kind of know how the circulatory system, how it circulates on the test. I'll ask some questions on it. So if you see the blue represents unoxygenated blood, and the red represents oxygenated blood. So as the heart, as a pump, receives unoxygenated blood into its right atrium, then it passes through a valve into the right ventricle. And then when the heart contracts, the blood gets pushed through that valve and into the pulmonary artery. Now, the pulmonary artery is the only artery that doesn't have oxygenated blood in it. So that might be a tricky question I might ask you. That takes blood away from the heart to the lungs, where it picks up oxygen. Once the blood enters back into the heart after receiving that oxygen through the left atrium, and then as the heart contracts, blood is pushed into the left ventricle, another contraction occurs, and through this tricuspid valve, or the aortic valve, and into the aortas that take it either up and into the brain, the upper half of our body, or down to the descending aorta, which takes it to the lower half of our body. The lub-dub of the beating of the heart, that lub-dub, lub-dub, lub-dub that you would hear with a stethoscope, is the opening and closing of the valves. So there you go. Now you know where the sound comes from. So you might need to listen to that a couple more times, but here we go. So once the arteries are taking oxygenated blood away, let me go back. I have to do this for you guys. The pulmonary vein is the only vein in the body that has oxygenated blood in it. So remember that too. So when we talk about arteries, 90% of the time they have oxygenated blood, except for the pulmonary artery, which is going to the lungs, and then the pulmonary vein has oxygenated blood. So let me try to remember that. So arteries are going to take your oxygenated blood throughout the body and deliver that oxygen to our cells. There's at the capillary bed, which is the smallest tube you can get in the circulatory system. Then we cross over to the veins. that the capillary beds are throughout all of our bodies, throughout everywhere, and as that exchange happens, it happens through a cell where the oxygen is delivered to the cell, and then as it passes into the vein, it doesn't have any oxygen anymore, and now what it has is CO2, and in that case, where that then binds to the red blood cell, the other material then travels in the circulatory system as well, and it sort of cleans us up, right? And it filters through our liver, and it filters through our kidneys, and we get rid of waste that way as well. That CO2 then goes up into our lungs, and we as we respirate, we breathe it out. So the circulatory system not only brings things into our body, but it also helps clear out some of the waste that we produce just in normal everyday life. This video will talk about some of the things that they're doing for cardiovascular disease. It's produced by AstraZeneca, which is a pharmaceutical company. They do a really good job explaining it. Some of the information on it is a little old, but it really does a good job of explaining why we still have an issue with cardiovascular disease despite treatments like medication and other things that we can do, certain drugs that we can give people, knowing what kind of diet we have to do, knowing a lot of the prevention stuff, we still deal with cardiovascular disease, and this video addresses that. So I would recommend that you download it and download the slide set and watch it.
Every unhealthy
pretty good.
has a
Here's different types of cardiovascular disease. So cardiovascular disease is like one big general term, and underneath it we have arteriosclerosis, coronary heart disease, angina pectoris is chest pain, arrhythmias, where you can have an irregular heartbeat, and what that does is it doesn't allow the pump to work as well, so the blood doesn't get circulated as well. You can have congestive heart failure, which we'll talk more about, heart disease, congenital heart disease, and stroke, and we'll talk about each one of these a little bit more here in a sec. So arteriosclerosis is these fatty deposits, and what I like to think of is when we have different types of fats that we consume, especially fats from animal products, tend to be sticky. They're low density lipoproteins, so they tend to be a sticky fat, and our arteries, as they expand and contract through our heartbeat, just over time can create little fissures. Now, fissures like little cracks in the inside. Now, it doesn't mean it doesn't crack all the way through and we, have this aneurysm, but just little tiny cracks in the inner surface of the vein or the tube. And when that happens, this sticky fat goes through and bumps into those little fissures and gets stuck. And if you get enough of those little fatty globules getting stuck, then the waste that also is traveling through our circulatory system bumps into it, and it starts to form a bigger plug, or plaque is what they call it. And so that becomes a problem. Those can either break loose and cause issues, or they can decrease the size of the vein and cause even issues as well. So our arteriosclerosis is the clogging of those tubes within our circulatory system. And certainly there's things we can do about that. We'll discuss that a little bit. So the little cracks in it, so if you look over here, it's nice and smooth, and you get little fissures that can form in here. And that can happen because of high blood pressure. So you're putting extra strain on the inner wall there. High cholesterol, now you're introducing more of the stuff that can get stuck. Elevated LDLs, that's the low density lipoproteins. Those are the sticky guys. Diabetes mellitus is like, it causes inflammation within those vessels that can also cause them to have little fissures formed, or irregular surfaces that allow the sticky fats to stick. Infectious microorganism and free radicals due to smoking can all cause inflammation within the tube or the vessel, within the artery, and cause it to form those little fissures or bumps or cracks that allow the low density lipoproteins or the sticky fats to stick. So we got to try to avoid this kind of stuff here, and we can do that. We've already gone through nutrition. We've done some exercise talk, and any of those things can help as well, controlling our stress, things like that. So, oops. Coronary heart disease. This one is the #1 killer of the cardiovascular system, known as a heart attack. Myocardial infarction is the medical term for it. A lot of our medical professionals will just say MI for a heart attack. And once again, when those vessels are clogged, then we get a blockage, and the oxygen then doesn't get to our cells, and of many things. So oxygen being one of them, doesn't get to the cells in our heart, and it's a muscle, so it needs the oxygen. And if it doesn't have it, it stops beating. Or it beats irregular, and then it begins to cascade. So right, those muscle cells all around there start to die off because it's not getting oxygen, and then you have a large part of that muscle that's not working, and the heart stops. So that's a heart attack. So it's really important to get people help within the first hour after a MI or a heart attack, because then they can get medications in there to break up those clots and get the heart going again. Obviously, you need to, get the heart going again, but after a severe heart attack, it's within an hour. Angina pectoris is just chest pain. Usually there's a circulatory impairment here. They can give you medications such as nitroglycerin. They relax the veins. A calcium channel blocker that slows the heart rate down, or something called a beta blocker, which prevents overactivity. A beta blocker is kind of cool. I guess it's not real cool to be on it, but a beta blocker is cool in the fact that it can actually set your heart rate. So at a prescribed amount, the doctor can adjust how much they're giving you, and it can set your heart. So if they don't want you to beat over 90 beats a minute, they give you enough beta blockers so you're under 90. This is important to know, especially when I was working at the rehab clinic, to know that somebody was on a beta blocker, because if I put them on a bike or a treadmill and we're just trying to get their knee moving and it elevated their heart rate, a beta blocker would stop it at a certain amount. So they would start to have pain, and you'd have to know why. You don't want anyone to have, a heart issue while you're trying to treat their knee or their hip or whatever. So it's important to know that beta blockers absolutely keep the heart from elevating over a certain amount. So anyway, pretty interesting medications that they're coming up with. Arrhythmia, once again, irregular heartbeat. You can either go too fast, which is tachycardia. For my motor heads out there, like your tachometer tells you how fast your engine's going. Tachy is a fast heartbeat. Bradycardia is a low heartbeat. So we don't want either one, right? So tachy is beating so fast, we're not getting good volume out of the heart. And Brady is so slow, we're not getting good pressure. So either one's a pressure issue. So this can lead to congestive heart failure, which is a malfunction of the heart. And people can have congestive heart failure for a long, long time. It's very hard. It's hard on the heart, and it causes us to retain water. So there's our fluids. It's really a difficult place to be with congestive heart failure. So once again, weak heart muscles, and the blood doesn't circulate as well. Therefore, we're not getting oxygen out as well. There's a lot of fatigue here, low endurance. Lots of complications with this one, just because you're not circulating oxygen in the body or nutrients. So this is really a bad deal. A lot of ways they treat this is trying to get the fluid off, and they give you a diuretic to do that. So you really work the kidneys hard to get rid of that fluid. It's just a bad deal all around. So vasodilators, digitalis, all kinds of stuff to try to improve the heart or to try to get the fluid off. Congenital heart disease is usually present at birth. Some of this can happen because there was a disease that affected the mom, like rubella, and passed it on to the child. Sometimes it can happen because mom is using drugs during pregnancy. Or you can have rheumatic fever. Either the mom has it or the infant can have it right away, and they're still considered congenital. So any one of these can affect the heart. I have a good friend that had this, and he does just fine. I mean, it had a low effect on his heart, but he does have a little heart issue because of I think his mom had valley fever. She was pregnant, something like that. Stroke, when we talked about arterial sclerosis, if one of those blockages within the vein breaks off, then we call that an embolus, right? So if it's just in there or it blocks the end of a vein, we call that a thrombus. So an arterial sclerosis can develop into a thrombus or an embolus. And remember, embolus is a wandering clot. I haven't come up with a way to remember that for you guys yet. I just know that it is. So embolus is a wandering clot. Aneurysm is the weakness in the blood vessel causing it to burst. Now, remember that the arteries expand and contract as our heartbeat does, and they can tend to wear out. The ascending and descending aortas are typically the spot where this happens, although this can happen up in the brain as well. When this happens up in the brain, it can also be a cause of stroke, and this is a bad one, right? So if you have a clot in there from an embolus that's wandered up there and gotten stuck, they can give you medications to dissolve that as long as you get to it pretty quick. An aneurysm, it just has to heal. They can give you some medications to help with the clotting of it, but boy, it can cause all kinds of problems, and usually over a greater area. And you get, anyway, they're all pretty serious, but those are ways we can cause stroke. And it all comes down to just a lack of blood flow in the brain. That's what causes a stroke. Stroke is also known as a trans-ischemic attack, or TIA. So get a picture of it over there. The rupture is an aneurysm. The blockage is a thrombus. The thrombus can be caused by an embolus that then gets stuck. So all about strokes. Strokes are awful. I don't know if anyone's had any experience with this, but I've worked with a lot of patients with stroke, and it's a really difficult thing. It's usually hemispheric. So if they get clot on the right side of their brain, then the left side's affected. You can get clots where your vision is impaired, or speech, memory, all kinds of stuff, the inability to swallow. It just depends on where in the brain that the stroke occurs, and it can be pretty awful. So there you go. Here's some warning signs. You can read them as well as I can. These usually are progressive. So if somebody comes in and they receive the medication, there is a waiting period, usually in the hospital, a couple of days, so we can monitor you and we'll get you up and move you and see kind of what happens. And if it begins to cascade or progress, then they have to do some more treatments for you. But anyway, it's a pretty serious thing. Stroke is a tough thing. So what can you do? Well, one of the big things you can do to prevent cardiovascular disease is not smoke, because of the irritation is not only to the arteries, but also the inability for your blood to carry oxygen around and keep your body healthy. So quit smoking. If you're smoking, don't smoke. Not only is it the chemicals in the smoke, but the nicotine is really bad for you too. So if you want to control cardiovascular disease, don't smoke. You can also cut down on saturated and trans fats. No trans fats at all. Those you don't have to, but you're going to get a lot of your saturated from animal fats. So that's why we like lean meats, or white fish is all low in those saturated. There are some studies ongoing that look at diets that can prevent cardiovascular disease or reverse it, and there is only one, and that's plant-based, although there's one called the Mediterranean that is highly plant-based and just a little bit of meat that seems to be working pretty well. So do your own research there. There's stuff going on. They're looking at different diets to reverse it. So I already talked about HDLs and LDLs, so there's some information on that. Go ahead and review that on your own. Make sure that you understand the difference between HDLs and LDLs. LDLs are sticky and they're bad. We can also control our weight. I talked about this already. Once again, it's just about controlling how much volume, right? So as we increase an adipose tissue or fat tissue, we still have to feed it with capillaries. So now we're increasing how much our heart has to work to get that blood to go to something that's not going to help it return. A muscle, on the other hand, as we get stronger and bigger, actually contracts and helps push that blood back through venous return back to the heart. Fat doesn't do that. Fat doesn't contract. So there are a couple of different ways we categorize where fat is laid down. The apple or pear. Apple is android and the pear shape is gynoid. The apple shape is more common in men, and is around the heart typically, so it's more dangerous. However, the gynoid shape, although more prevalent in women, once women hit menopause and reduce estrogen, they start to lay down fat in the android or apple shape as well. So that's kind of a bummer. But apple is worse for the heart. The android is worse for the heart. So your diet, talked about that. Make sure you're exercising. Exercise is great for a lot of reasons, right? It helps control your stress, helps improve the circulatory system, the efficiency of your heart. It reduces LDLs, all kinds of stuff. So a good diet and exercise is super important. Managing stress is really important. We've talked a lot about this in this class. So you should have some pretty good coping strategies now that aren't going to be harmful to you, like smoking or drinking or doing drugs. Those are poor coping strategies. So having a good coping strategy is super important, especially if you're like a hot reactor. You're somebody who's got kind of a temper. You can kind of control that, right? So managing stress is super important. Heredity has a little bit to do with this. Age, gender, race. Certainly, there's greater risk factors as we get older. Men tend to have an increased risk of cardiovascular disease. Women tend to be a little bit more protected from it until menopause. So there is some gender or biological sex differences as well. So anyway, interesting studies out on this one too. So I think I put it in on the exercise one. I'll have to look back. There's some papers that I'll put on the canvas for you. Since 1984, more women have died from heart attack than men, only because of it's not mistreatment, it's misdiagnosis. So that's part of it, and doctors are getting way better at it. So I'm going to show you a video that's out by the RED campaign, and it's a pretty good indication of why else women die more often. They just assume it's something else and keep going with their day. I really believe, guys, we're just kind of wimpy, I guess. We have a little chest pain, we're gonna run to the doctor. Ladies, you guys have chest pain, you're like, oh, maybe it's something I ate, and you just keep going with your day and trying to, take care of everything that you have to do. And anyway, it's costing you. So the next slide is a video. Please watch that one as well. And it talks about a couple of the reasons why women this statistic is happening, that more women are dying from cardiovascular disease than men, even though they may have less episodes. Here it is. Look for this on YouTube as well. So it's the RED campaign for the American Heart Association. Okay, new weapons against heart disease. We've got all kinds of ways to diagnose this. Unfortunately, people typically don't come in for PET scans or angiograms until they have some sort of issue that's picked up. So hopefully we get it earlier. We don't want to get to the point where we have to have a bypass or an angioplasty or any of those things, which you can see is down here. So you can read through these. Some of the ways that we're treating heart disease, in particular heart attack and stroke. Some other weapons against it. An aspirin a day for a long time was something that has been recommended. Consult your doctor on that first. Just don't jump right into that. Thrombolysis is an injecting agent that we can put in. It's chemical that breaks up those clots. Been a pretty good tool as well. So it has to happen within the first hour, no more than 3. And to get that clot broken up. Okay, there we go. And make sure you review that stuff. Know the pattern of circulation in the heart and pulmonary vein, pulmonary artery, and what make those unique. And make sure you look at those statistics. And if you have any questions, please email me or text me, and I'll be glad to answer.